for one, am very excited because this is a hot topic in our nation right now. So many people are unaware of the healing effects and properties of CBD. Most people think that it's illegal and that you can't get it. So hopefully this is going to give us some great information and a better way to explain it to our family, our friends, and those who really need it. Our next speaker, we got a chance to hang out a little bit here over the break, and he and my husband had quite a bit to discuss about military matters, so you might all need to stand at attention here, no slouching in your seats, for our good friend. Please give him a warm welcome, Michael Lewis.
All right, I guess my speaker or my microphone's working. Let me go down a little bit. Is that a little bit better? Okay. So I tend to talk loud anyway. So I appreciate those of you who have hung in here. I know it's been a long day, and so hopefully you'll find that we'll discuss some interesting topics. I don't have a ton of slides. So hopefully we can get to the end, and if there's any big questions, or we can move on to the next speaker and maybe get back a little bit of the time that we've gotten behind on. So I always like to start this off as, what do you think these three men have in common here? Just three general names, and you can see you've got one of them, the one at the top is a neuropharmacologist at the NIH. The second one, who passed away a few years ago, Julius Axelrod, was a Nobel laureate who is basically the person who discovered neurotransmitters back in, I think it was in the 30s. I'm not completely sure, but anyway, the 1970 Nobel Prize for Medicine. And then the one on the bottom is a physician, professor of neurology and neuropsychopharmacology at the NIH, and those two gentlemen are actually still at the NIH. So what do they have in common? Anybody? Just shout it out. Anybody know? What? Probably something with CBD, or we wouldn't be here, right? So, in fact, those three gentlemen are named as the holder or the inventors of this particular patent. And you can see it was granted in 2003, October 7th, 2003. So it's been around for a while. But what's really interesting is when you start to look a little bit in the more detail. So what's the patent? The patent is cannabinoids as antioxidants and neuroprotectants. Well, that's interesting. So, but what does it really tell us? So just in the abstract, you can see here that cannabinoids are found, I don't know if you can see this all in the back, but cannabinoids are found to have particular applications as neuroprotectants. For example, in limiting neurologic damage following ischemic insults, degenerative disease, such as stroke and trauma. I'm losing my track here. And possibly the treatment of neurodegenerative diseases such as Alzheimer's, Parkinson's, HIV, dementia. And then they go on to say that the neuroactive, or the non-psychogenic, it's hard for me to read it here, so I'll walk back over to the computer where I can see it a little bit better. But the non-psychoactive cannabinoids, such as cannabidiol or CBD, which is what we're going to talk about here for the next half hour or so, are particularly advantageous because they avoid the toxicity of the psychoactive compounds. The one that we know the most about is, of course, THC. So, who owns this patent? It's an interesting question. The United States of America owns this patent. Who is the United States of America? That's us. So technically, everybody here, if you're a U.S. citizen, you own this patent. Isn't that interesting? Why? Because the U.S. government can't even come to its own conclusion. They contradict each other. So if you look at the FDA and the DEA, they tell us that CBD, cannabidiol, is a Schedule I drug. And what does the Schedule I drug mean? It has high potential for abuse and no currently accepted medicinal use or medical use. And there's a lack of any kind of safety for the use of this drug whatsoever. That's what the FDA tells us, and it's enforced by the DEA. But here you have the NIH, the National Institutes of Health, holds a patent for that same substance that we're being told is a Schedule I drug and has no medicinal value. So how does the government reconcile this? And that's part of what the battleground is now. And it gets pushed in with the concept of marijuana. And there's 9 more states that are voting on use of marijuana this coming election. And so it's a hot topic. But when we talk about a patent for CBD, we're talking about the use in prophylaxis and treatment of disease. Those are quotes right out of there. Particular application as neuroprotectants. So, and no signs of toxicity or serious side effects. Completely contradicting what the FDA wants to continue to tell us. So what does this have to do with anything? Well, fairly recently in our medical history, we've come to discover that we have what we call an endocannabinoid system. And so what that means is our entire body has receptors for these cannabinoids, and they're basically broken up into 2 main categories as far as we know, because this is all relatively new understanding of the science. We have CB1 receptors that are found mostly in the brain, and we have CB2 receptors that are found mostly in the peripheral body in the immune system. Now there's some crossover and there's some in each other, but we'll get into that. So, but let's look at the brain. So where do we find it? We find that cannabinoid or CB1 receptors are found throughout the cortex, the cerebral cortex, but also throughout the limbic system. So you got the basal ganglia, you've got the thalamus, you've got the hippocampus, the amygdala, and you even have, let's see if we can get this to move forward. Okay. Oh yeah, it did. And the cerebellum. So when we're talking about the limbic system, we're talking about emotion, memory, movement, thought, planning. I mean, all these things, all these important parts of the brain. One part that's really interesting is there are no CB1 receptors in the medulla oblongata or in the brainstem, which is responsible for our cardiorespiratory function. Why is that important? Because if we overconsume some of this, if you overconsume alcohol, have alcohol poisoning, you can literally drink yourself to death, right? It's virtually impossible to overconsume CBD to the point of death because you don't stop breathing and your heart doesn't stop beating. Unlike cocaine, where it induces sometimes arrhythmias and heart attacks. Unlike alcohol, where you have problems with breathing. There are no CB1 receptors in the brainstem. Okay? Now, there are CB2 receptors around the brain as well. There's just not as many. And we also know that the immune system is very active in the brain, as you would think. So what are those receptors there for? Should be your next question. Well, the receptors are there for the endocannabinoids, and we know of several now, and we're discovering more and more every day. So this is really cutting-edge science, but these are the 2 main ones that we've known about for a few years. And the one on the left is called basically anandamide, and it comes from the Sanskrit word ananda, which means bliss. So as you can imagine, if we're interacting with parts of our brain with something like this, bliss. How do we feel bliss? It's a hug. It's a kiss. It's a seeing somebody that you love. It's a good feeling. It could be a runner's high even. That releases these endocannabinoids to make the brain believe that you're happy, you're doing well, and you're under control. That's a really good thing. And the one on the right, 2-acetylglycerol, sorry, I'll just call it 2-AG, also has more recently been discovered, and it interacts a lot with the CB2 receptors. But I'll walk you through this in a little bit in the next slide or two. Luckily for us, nature gave us two other substances that we call phytocannabinoids, or from plants. And they have, while they don't look anything alike, like anandamide and 2-AG, they have similar functions, and we'll see how they interact here in just a little bit. But those two phytocannabinoids that we'll focus on are going to be CBD and THC. And everybody knows what THC is, right? That's what when you smoke marijuana, that's what makes you high. Well, one of the problems is over the last 40 plus years, since the 60s, 70s, if you were to take a marijuana joint from 1965, for example, and compare it in analysis to what today's marijuana plants are, they're two totally different things. What we've done is we said we want to be high, and so breeders have bred out the CBD, which balances the THC, and they bred up the THC. But it's really more about the fact that they bred the CBD out of the marijuana plant. And so marijuana today is far more powerful from a THC, a psychoactive, get high point of view than what it was 30, 40 years ago. Okay, so how does this all kind of come together? In just basic terms, you have the CB1 receptors and you have CB2 receptors, and you got an anandamide that then interacts with those and releases a chemical cascade that causes that feeling of bliss. Well, you have THC that does essentially the same thing. Not exactly, but essentially the same thing. On the CB2 side, you've got 2-AG that interacts with the CB2 receptors very well, has a high affinity for it, and you have CBD that also interacts with those receptors. Okay? But they also cross over, so it's not just one-to-one like that. So you also have some interaction with the CB1 receptor from CBD, and you have some interaction with the CB2 receptors from THC. Okay. Weak, much more weak than the others. Okay. So what does that get us? Well, the biggest thing that I found in my medical practice, and I am a practicing allopathic MD physician, is it really, CBD helps in anxiety. It helps tremendously. Of course, that's what people often smoke marijuana for. But we're going to talk about a little bit different sources of CBD here in a second. Interesting thing. Now, I come from a world where I've gotten to be known over the last 8 or 10 years as the fish oil guy or the omega-3 guy. I've developed some protocols to help soldiers recover from traumatic brain injury and how to prevent traumatic brain injury and concussions. And my approach to that was, let's saturate the brain with omega-3s and help people really quickly. Let's get that balance back between omega-3s and omega-6s really quickly. Well, CBD and the endocannabinoid and the phytocannabinoid system, it was a hard lesson for me to learn. It's the opposite. You have to start low and build up, because you can overwhelm the CB1 receptors. Even with CBD, you can overwhelm them, and while lower doses will help with anxiety, you can actually induce anxiety. And I wouldn't know this if I hadn't done this myself purely by accident. I had a big jar of CBD, and I was scooping some out into a small jars for a patient, and I just did what I would normally do. It's like peanut butter. I just licked the knife. Well, I gave myself a really big dose of CBD, And about an hour later, I started having a panic attack. And I've never had a panic attack in my life. At first, I thought I was having a heart attack. And then I thought, oh, no, all right, check this. No, I'm good. I think I'm having a stroke. I mean, and then I get up to go, and I was like, you know, walking down the stairs and told my wife we need to go to the emergency room. Then it dawned on me, why is this different? And the only thing I had done different was CBD. Great night's sleep. I slept about 15 or 18 hours, and I was it was much better the next day. So if you can take too much CBD, and it will cause anxiety, and that level is very different for every individual. But again, there was no risk of me dying because it's very safe. I wasn't going to stop breathing because it doesn't interact with the respiratory or the cardiovascular nuclei in the brain. What it does is it interacts with the limbic system, and it helps with stress, anxiety, fear, emotions, because it works on those particular parts of the brain. It also works in the hypothalamus pituitary adrenal axis to decrease our stress hormones as well. So when we're looking, let's go back to our CB1 receptors, our CB2 receptors. So when we have anandamide, we know that CBD is a weak agonist of CB1 receptors. Very weak, but there is some. It also, what it really does is it potentiates anandamide. And what it actually does is it blocks the enzyme that reuptakes the anandamide so that more anandamide is available to interact with the CB1 receptors. And that's really a little bit more detailed biochemically how CBD helps, not just with the CB2 receptors, but how it deals with the works on the CB1 receptors. It's a little bit of directness, but it's really more of an indirect thing, but it's incredibly powerful for that. So what do we know about it? So if you look at hemp or you look at marijuana, there's lots of cannabinoids. This is just a couple of them. There's over 100 that have been identified so far. But if you look at the list around here, everything from antipsychotic to anti-epileptic, right? So we're looking at CBD. You're seeing these studies coming out about epilepsy and how CBD can decrease or even eliminate seizures. But it also has anti-cancer properties. It has antibacterial properties, analgesic properties. You could go around that, and I don't want to read them all off, but you could see that the medicinal value of CBD is tremendous. Delta-9 THC, there's some. I'm not going to say that there's not. But the real medicinal value in the cannabis plant is really in the CBD. Well, the history of cannabis actually really suggests safety to us. If you go back 110 years to 1906, CBD was actually manufactured by major drug companies, Eli Lilly, Wyeth Park Davis, Sharp and Dome at the time. So it was actually a pharmaceutical produced extract of cannabis. And if we pull out a little bit of this, it's been given the name cannabidiol, and it has none of the physiologic activity typical of marijuana. So that's important. Again, CBD cannot get you high. It's medicinal. In fact, that's 100 years ago, that's why pharmaceutical industries were interested. And it's also why pharmaceutical industry is starting to become interested in it again. Okay, let's look into a little bit into the scientific literature. One of the big problems with cannabis in general, CBD in particular, but cannabis in general, is there's not a lot in the scientific literature because of the DEA, FDA situation. So it's been basically outlawed since around 1937 which is really kind of interesting because you think about it, when you actually start to dig into some of the history, what we learn is George Washington, Thomas Jefferson, our founding fathers, many of them were hemp farmers. They actually grew this stuff. It was a cash crop. And it was used for everything. It was used to make paper. Our Declaration of Independence and our Constitution, at least one copy of each, is written on hemp paper. But yet, the United States outlawed it in 1937. Go figure. So, it basically got thrown under the bus. I'm not going to get into it, but it got thrown under the bus with alcohol and a whole prohibition. And there's a whole long history about that and conspiracy theories and this, that, and the other. And they're pretty much all true. But the bottom line is, well, it doesn't matter how it happened, but the fact that it did happen. And we're just now starting to come out of the dark ages and being allowed to actually do scientific studies on cannabis and CBD. And so when you go into literature, the amount of literature is actually skyrocketing right now. And this was just one paper I wanted to pull up, modulating the endocannabinoid system in human health and disease successes and failures. Because it's a good, if you're looking for a nice summary, this is from the scientific literature, this is a nice summary. And you can see here that they reiterate that modulating the endocannabinoid system activity holds therapeutic promise for a broad range of diseases, including neurodegenerative, cardiovascular, inflammatory disorders, obesity and metabolic syndrome, cachexia, chemotherapy-induced nausea and vomiting. Why do you think cancer patients like to smoke marijuana? Is because of that, so that they have a little bit more hunger, and they stop, with the nausea and vomiting, or help get it a little bit more under control. Tissue injury and pain. It worked great for chronic pain in particular, among others. So you can see it's got just continues. One of the problems that you face when you have a substance like this that works in so many areas is most people, and particularly doctors, will look at it and say, well, if you're trying to tell me it works on all these areas, you must be coming from some other planet, because nothing does that. Why do they say that? Because their drug model that they have come through the medical system has been one disease. Well, you look at epidemiology, the basics. So I used to be the head of epidemiology at our military medical school. And the basics of epidemiology came from infectious disease 100 to 200 years ago. You have one bug, one drug, one cure, right? You have a strep throat, you take penicillin or whatever antibiotic, and it's cured, right? One bug, one drug, one cure, boom. So now we move into the world of chronic diseases, and our whole thinking is still on that simple model of one symptom, one drug, the symptom goes away, it must work. But great for the pharmaceutical industry because you have to keep taking, because you didn't cure the disease, you're not getting to the root of it. So doctors think that way. I am as traditionally trained as any doctor out there. My father was a surgeon. I started down the surgical path. I went to an allopathic medical school. I spent 20-some years in the Army as a physician. You're not going to find them any more traditionally trained than me, but I've at least been able to see that there are other ways to do it. We don't have all the answers in our medical system, and you have to start thinking outside the box to look at things like CBD. Cannabidiol for decreasing addictive use of marijuana, a case report. So Scott Shannon is a physician, an MD, a psychiatrist in Colorado. And I work with Scott we're both members of a scientific or medical advisory board to CV Sciences, which is a hemp-derived CBD oil company. And Scott recently published this case report where he had a 27-year-old who was bipolar and essentially addicted to marijuana because of the THC, which does have addictive properties regardless of what people tell you. And what he was able to do was able to transition this 27-year-old off of marijuana and onto hemp-derived CBD. So basically did this. He just slowly reversed them to the point where now this 27-year-old is only taking CBD to control his bipolar disease and anxiety, and no longer needs or requires or has the want to do that with marijuana. So Scott worked out of the Wholeness Center in Colorado, and I only bring that up because he's just in the process of putting this paper together. I helped, we've talked about this quite a bit. And currently has 136 patients that he has looked at in the clinic using hemp-derived CBD for anxiety or sleep disorders, and he's used it up to 9 months, and it's ongoing, including 27 pediatric patients. He's had 59 have had 3 months or more data, but as we go further out. And you can see here for the adults and the pediatrics, the different scales, the psychological scales that they're using to measure anxiety and sleep disorders. And so what they've found is that, that they realize that cannabis has a long tradition in the healing arts. And what he's found is dramatically reduced sleep and anxiety disorders in both of those pediatric and adult populations. So where does that leave us? Cannabis is a long tradition of healing. Thousands and thousands of years. It's described even as far back as the ancient Egyptians. The endocannabinoid system, you have to understand what its function is. And it's all about balance. It's something that Western doctors don't typically talk about, that concept of balance. Whether you want to call it chi or balancing hot and cold or whatever, it's a very esoteric Eastern concept to most Western trained doctors. But the cannabinoid system, the endocannabinoid system is the same thing. There's a tone to it, and we need to have it balanced. And we're out of balance. Just like with omega-3s and omega-6s, we're out of balance. And what's the result? We're seeing anxiety disorders going through the roof. We're seeing obesity and other problems that continue to climb. But you also have to realize that CBD, it's well tolerated and it has a calming effect. If you take it, I'll give you a good example. Just the other day, about 3 days ago, my wife really was having a rough day. She's working through some issues, and she was just like, I'm just jittery, and really the anxiety is overwhelming. And so I gave her some CBD. I gave her a particular dose. It was 15 milligrams of CBD. And she said, how fast will it work? I'm like, well, 15, 20 minutes, you should notice a difference. So about 20, 30 minutes later, she says, I'm feeling a little bit better, a little bit calmer, but not quite there. I gave her another 15 milligrams, and in 15, 20 minutes, the anxiety was gone. It can work that quickly and have that profound of an effect. If you want to learn more at the very scientific level, I would highly recommend this book by Dr. John Hicks, The Medicinal Power of Cannabis. He focuses very much on the CBD side of things, but he doesn't shy away from the THC side of things. And it's fortunate that we got this book published, not we, because I wasn't involved in it, but I say the world is fortunate to get this book published because the week before the book launch, Dr. Hicks was on vacation in Mexico, and unfortunately had a massive heart attack and died. And so we actually never saw the release of this book. But it's an incredibly well-written book. I would highly recommend it if you want to learn more about it. What you might not want to really get too much into is what's the popular press talking about. Go with a little bit more scientific way of approaching it. Not Time magazine or National Geographic per se. There's some good things, of course, out there, but it's popular. It's in the popular press. It's a big topic. And one of the things that people always get confused is, oh, that's pot. It must be a drug. Well, what I really want to just kind of finish this up, and then we'll got about 10 minutes or so to go. What's the difference between marijuana and hemp? So CV Sciences, for example, is a industrial hemp-derived CBD oil. And by definition, which is given to us by the US government, by definition, hemp is less than 0.3% THC in order to be called hemp. It actually comes from the same plant. But those two plants, marijuana and hemp, are grown incredibly different. On the right, you've got medicinal cannabis, right? It's an enormous carbon footprint. It's grown indoors. It really actually is quite environmentally harmful. The water demands, all the different things that you have to put on to continue to grow a plant this big. Industrial hemp grows like bamboo. It grows 20, 30 feet in the wild. And so there's farms now in Colorado and Kentucky where they're able to grow hemp, and it grows like bamboo. So CV Sciences actually gets their hemp, they're the largest importer of hemp oil, and it's grown in the Netherlands and processed in Germany, and then they import the oil. So hemp is grown in the wild, basically. It requires a lot less water. It's grown outdoors. And so it's got great sustainability, and it's good for the environment. There's a reason why our founding farmers grew hemp as a cash crop, not just for paper, but also it's what rope was made out of up through World War II. Nylon rope is actually a relatively new invention. Before that, it was grown. The U.S. Navy maintained farms through World War II so that they had a constant supply of hemp to continue to make rope for the U.S. Navy through World War II. Okay, I want to switch topics just slightly, and we'll bring it all back together. I want to talk a little bit about concussions. My medical practice is actually, I'm very functionally medicine oriented, and I focus on concussions and head injury. And so I just wanted to briefly talk about this. Most of us think we know what concussions are. If you do, great, but I'll tell you, the scientific literature, the scientists can't agree on what's a concussion. So if you know what a concussion is, good on you. We can't figure it out. There are between 25 and 45 different definitions of concussion in the medical literature. There's no blood test for it. There's no single test, in spite of what some companies say. You can't sit at a computer and it will tell you you've had a concussion. So we don't really know what a concussion is, but we do intrinsically. We know you bang your head, the brain gets bruised, and you have problems, and it's a complex pathophysiologic process that follows from there. You can see it's hugely variable. Whether you have mild TBI or moderate TBI or severe TBI, getting back to the baseline is not always possible and incredibly variable. If you look over on this end and you've got the sort of the statistical markers of variability, it's all over the place. So there's huge variability on how people recover from a head injury. And when we say concussion, that's just a nice way of saying it's a mild or even moderate traumatic brain injury. A concussion absolutely is a traumatic brain injury. So don't ever think that it's not. We soften it just by our language. Okay, but it's not just necessarily about traumatic brain injury from the NFL, which gets all, the big press. And that's great. It's creating awareness. So you have sports concussions, but you also have our military that's been exposed to a lot of IV blasts, you have car accidents, you have falls. The biggest killer of and cause of traumatic brain injury are very young and are very old. I won't make any jokes about the Secretary of State and falls, but there's other blunt trauma as well. You also have to look at stroke and anoxia. Somebody has a heart attack and they don't get blood to their brain for a couple of minutes and they're brought back, or during surgery, or a near drowning, or probably a little bit more near and dear to people in the audience here is chemotherapy. I will say that chemotherapy, and we now have a term for it, we call it chemo brain, or that fogginess after chemotherapy. That's because you have had a traumatic brain injury induced by chemicals. Well, let me put it this way. All those things on the previous slide, that's the initial injury. And it doesn't matter whether it's from a stroke or from an IED or a car accident. That's the primary injury. The secondary injury is all these biochemical cascades that last potentially for hours, days, weeks, months, even years. So it's this system of chronic inflammation. Our cannabinoid system is out of whack. Our omega system is out of whack. And it perpetuates these chronic biochemical cascades over time. So we end up with symptoms such as difficulty with memory, thinking, feeling like your head's stuffed full of cotton, you can't think clearly. We have physical symptoms, lights bother you, or noise really is irritating. You can't handle that sensory overload, or balance. Close your eyes and you fall over, type of thing. But it's also maybe a little more subtle with emotion and mood. So, for example, a teenager who's playing high school football or high school soccer, how do you know when a teenager is more emotional? So that's, but they know. Ask them. They're more irritable. They're quicker to anger. And so it's a little more subtle, as well as sleep. So some people sleep more, some people sleep less. I say concussions are like snowflakes, or traumatic brain injury are like snowflakes. No two people are the same, and no two injuries are the same. No two recoveries are the same, and no two therapies seem to work for you can't just lump people in. It has to be very individualized therapy to help people get back to where they want to be, because you've got all these pre-injury factors, injury factors, post-injury factors that then lead to problems in the cognitive and behavioral and sensory-motor, and all these symptoms on the right-hand side. Some of them you can't quite see sort of in the middle, but all those symptoms again. It's a complex web. It's not one drug, one cure anymore. It's very complex. But what does the CDC tell us about the treatment for head injuries? Rest, take it slow, talk to your healthcare provider, who doesn't know anything anyway about it, because none of them do. Very few do. And I was talking to a friend of mine who's a researcher at University of London, and a wonderful, wonderful lady, incredible work. And I was lamenting about that. It's like, God, it seems like we're not doing anything different than we would have done 500 years ago. She goes, oh, that's not true at all. And I'm like, oh, really? And she goes, yeah, it's at least 1,000. So we just don't do anything different. Rest. Go sit in a dark closet. Fortunately, we're starting to question these ideas. We're looking at, is exercise a way for recovery? You have back surgery. You don't lay in bed for a month in a dark room. That's absurd. You have knee surgery. You're physical therapy like within a day or two. Why are we not doing that for our head injuries? And that's being looked at very scientifically by some really smart, good people. Tie this back in with CBD. What's my experience? It's limited in my patients, just because I just literally earlier this year, when I retired from the military, I spent 31 and a half years in the military. I retired about 4.5 years ago, and I started a nonprofit called Brain Health Education Research Institute, and I'll show you a slide with contact information. And I've been doing that for a couple of years, as well as consulting to some companies. So just earlier this year, I kept getting asked, where do you see patients? Where do you see? Nobody talks about the things that the way you do. Nobody does the things you talk about. And so eventually I was like, all right, I've been retired long enough. That was fun. In the military, you change jobs every 3-4 years. So after 3-4 years, I was getting antsy. Like, I got this retirement stuff. I got to do something else. So I opened up a practice earlier this year where I focus on traumatic brain injuries and concussions. And like I said, I take a very functional approach to it. What I found that is tremendous is I use really high doses of omega-3s. Makes a huge difference. But for those patients that are having problems with anxiety, and some of them that have problems with depression, but anxiety, I have not yet had a patient that did not respond to CBD and lower their anxiety levels. And I'll give you one good case report. I know it's just a case report, but I can tell you I've got about 10 good patients that their anxiety levels are unbelievably well controlled with hemp-derived CBD without any of the THC that's going to get somebody high. And it's a nutritional supplement. You can buy it over the counter. It's legal across the United States. It's a nutritional supplement. You can buy it online. You can buy it at a local health food store. But I want to just highlight one case to sort of finish out the day, and it's the story of Bobby. And if any of you know me or know about me or have ever come across any of the work that I've done, you probably know the story of Bobby. And story of Bobby was actually I'll show you it was actually published, but Bobby was in a really bad car accident in Northern Virginia in March of 2010. And you can see a quick progression out to October of 2010 where he's standing there with his mom around Halloween. But the story is really more about the fact that when Bobby was in this car accident, I got a call from a friend, and it was coincidentally a friend who worked at the FDA, and he said, hey, this friend, a really good friend of mine, his son was in a bad car accident. They don't think he's going to live. Do you think that high doses of fish oil might help? So I'll talk to the father. Well, I basically short the story, the father had to throw a fit, lay down, throw a tantrum in the ICU for them to finally say, all right, we give up. We'll put some fish oil down the kid. They're telling him that his only son is going to die. Just let him go. Pull the plug. Let's shorten it so he's not in any pain, prolonged pain. And obviously, you can see here he is months later. And actually, in the upper right hand, 3 months later, that's Bobby at his high school graduation. And you can see there. So we published this report, Therapeutic Use of Omega-3 Fatty Acids in Severe Head Trauma. And it's still to this day, I think it was published in 2012. It's still to this day the only case report about high-dose omega-3s specifically used in traumatic brain injury. Lucky for me, CNN picked this up in October of 2012, and Sanjay Gupta did a special on it. And he subsequently has done another special tying it together, but with this particular special, and it's actually still up on CNN even years later. But what I really want to do is just kind of finish up with a quick update on Bobby. Well, Bobby was struggling. He had tried to commit suicide a couple of times, and that's what people do when they've had a head injury. You take a healthy 18-year-old who was on the high school football and soccer team, and now you got a 22-year-old that's basically crippled, having to walk with a cane or a walker, and he comes from a very close-knit family. He's like, what girl is ever going to want to date me? Somebody who is crippled. I'm broken. What girl, how am I ever going to get married? And who would ever want to marry this broken person? And so he had tried to commit suicide a couple of times, just was a big handful for the parents, and they were literally at wit's end. I finally convinced them, let's start on some hemp-derived CBD oil in June 2015. I got a phone call 2 weeks later, and Bobby gets on the phone himself and he says, Dr. Lewis, I'm no longer depressed. In fact, I've stopped taking my antidepressant medications. He goes, and my anxiety levels have completely vanished. What do you mean? I asked a girl for her phone number. That's so huge for a 22-year-old who for 4 years is living in this crippled body. But it was even better that he's like, and I walked across the entire physical therapy room without a cane for the first time ever since the accident. I now have it as a goal that I am going to walk without any aid full time. Was that because CBD had some miraculous muscular thing for him? No, not at all. It was here. It was in his head. The anxiety that he was going to fail was so much that he was refusing to try until we could get his anxiety levels down to the point where he was willing to try. He had nothing to lose. And he was able to walk across a room for the first time ever. So he set a goal to walk without assistance full time. But what I really want to share with you is a recent email. So that was a little over a year ago when he started. And this email I got in April. So about 10 months or so afterwards. And I'm going to read this in case you can't see it, because I can't quite tell from back there. This is Dr. Lewis. Thank you so much for giving me CBD oil. It drastically changed my life. I cannot begin to describe it with words. Thanks to CBD oil, I'm feeling much more comfortable in my own skin. I'm feeling more social. I'm making big noticeable changes. I'm doing stand-up comedy now. This is a kid that couldn't ask a girl for her phone number, and he's now doing stand-up comedy, not in any place big, just Los Angeles. So, he's doing stand-up comedy in LA. I have my own place. He moved out of his parents' house. I got a raise at my job, and I'm feeling very optimistic about the future. A friend I made while doing improv, not just stand-up comedy, but improv comedy, told me, and I've been told this repeatedly, that I have a great personality and a great zest for life. I can't wait to see what adventures come up next in life. Is that not a powerful thing? Now, Bobby's just one case, and that does not make science. It makes for a great story, and I know, as a physician and as somebody who's done and published dozens and dozens of scientific papers, we have a lot of work to do. We can get the government to stay out of our way, number one, to be able to allow us to do research. We can really help a lot of people. And it's not about smoking marijuana, and it's not about passing, these laws are going to help, but it's really the medicinal value, the medicinal help that CBD can bring to us. So keep in mind, you own the patent for CBD. The American people own the patent. The US government just holds it for us. So we need to always keep that in mind and move forward with it. This is a bit of my contact information. Up at the top is just a little bit about brain health education and research. It's a 501c3 organization, brainhealtheducation.org. Lots of information about brain injuries and focused mostly on omega-3s. And the bottom half of the slide, brain care is what I chose to call my little medical practice, and CARE standing for Concussion Assessment Recovery Education. And Potomac, Maryland, just outside of Washington, D.C., about 3 miles from Walter Reed National Military Medical Center, where I retired out of Walter Reed. And so that's all my contact information there. And so that's the nonprofit side and my medical practice side. But the last slide that I want to put up is actually, I'm really thrilled that just not even a week ago, but earlier this week, came out with my first book called When Brains Collide. What every parent, or what every athlete and parent should know about the prevention and treatment of concussions and head injuries. And you can see the information here. You can buy it on Amazon. It's available on Amazon.com. I brought a few copies with me in case somebody has to have it now. I'd be happy to not have to carry them back home. But I'm really excited about it because it tells the story, and actually the story begins and ends with the story I just told you about Bobby. And how we came to treat them with omega-3s. And I finished the book, the very last section of the last chapter of the book is about how things have progressed, you know, whatever happened to Bobby type of thing. And I talk about using CBD because I wanted to kind of set the stage. Maybe I'll write a second book, I don't know. But if you have a chance, it's getting great reviews. I've got advanced praise from huge leaders in the field, thrilled about it, and happy to talk to anybody. We have gone about 45 minutes. We could either take one or two questions if anybody has any burning questions, or we could move on to the next speaker because it is now a little bit after 6 o'clock and I know it's been a really long day. Are there any burning questions? We're not going to do a microphone. You're just going to have to shout them out, and I'll have to try to see you. You know, I got the lights in my eyes. So I think there's somebody right here, right? Mm-hmm. I was just at a conference, Integrative Medicine for Mental Health, and I missed him by minutes. I was trying to find him. I'd been out to his clinic in Reston, Virginia, and talked to I've talked with the people out there. I've not talked with him particularly. I would agree, and he's done a very good scientific way of looking at using specs. So talking about Daniel Amen, is a psychiatrist who's become pretty well known for his work in ADHD in particular, but has also looked at NFL players and traumatic brain injury and stuff like that. And I think the question or the comment was basically he's done tens of thousands of SPECT scans through his clinics, and he's also looked at marijuana and the effect of marijuana on a SPECT scan, and it's not good. It's not good. I'm going to make a leap, and I'm not saying this from a scientific basis. I'm saying this from a personal opinion that is why we need to move away from the THC of marijuana and really focus on the CBD that is the medicinal value of the cannabis plant. And I bet you if we were to do a study of looking at CBD and SPECT scan, I bet you we would see that we'd probably either have an improvement in our brain, or certainly it's not going to be anything like what you would have from marijuana. Would you agree? I would be happy for that too. I keep coming across them and missing them every once in a while here and there. Any other burning questions? I think it's... One of my good friends is a leading Alzheimer's researcher and out in Phoenix, Arizona. And we have been looking at the idea of putting together some products and stuff on the nutritional side to be able to help with Alzheimer's. It's really complicated. And just as traumatic brain injury, and I say we can't decide what it is about traumatic brain injury and how to define a concussion and so on, Alzheimer's is a little bit further ahead in that, but it's still, we're just learning how to crawl when it comes to Alzheimer's research or traumatic brain injury research. We're barely even able to crawl, let alone get up and walk and run. We have a long way to go. What it could potentially do, if Julius Axelrod were alive today, I think he would say, well, what his research pointed to is that it can help with those neurodegenerative diseases, help push them off. So it gets really, really complicated, and the idea of, and you could tie in tauopathy and amyloidopathy into the accumulation of amyloid beta in the brain. That's a marker, but if you actually get into some of the science, what you'll find out is just because you have high levels of beta amyloid doesn't mean you have symptoms. And you can have symptoms without the beta amyloid. So is it really causative? And what if we eliminate the beta amyloid? And there's drugs out there, experimental drugs out there that can do that. I believe that CBD and omega-3s can help with that. It's not targeting specific, we're talking about nutrition. So using nutrition as a therapy is a little bit different than trying to use a drug that targets a very specific biochemical process and it stops it. Whereas nutrition, we're kind of feeding into the higher level and with the trickle-down effect to get the answers, and it takes much, much longer. It takes, just to give you an example, for omega-3s, if you dramatically increase your omega-3 levels, it takes, as best as we know, 12 weeks to reach a saturation point in the brain to where you finally have changed the structure of your brain. So do I believe that it has a role? Yes, I believe it. I'd love to see the science behind it. Again, we're just coming out of the woods on CBD and the whole cannabis thing only because states have stood up and, led by Colorado, saying, we're going to legalize it and we don't care about you, the federal government. We're going to legalize it anyway and do it anyway. And it's only because that whole process. I don't remember how many states now, and like I said, 9 more states coming up for vote in a few weeks. So all that's going to lead to us being able to do more and more science to start to answer questions like that.
Michael?
Okay. I think we're being called off the stage.
I'm so sorry.
And no. So let me just say, what I'm going to do is I am going to grab my stuff when I come off the stage. I'm going to go out back because I want to be respectful of our next speaker. And so if anybody wants to ask me any more questions, I will meet you up in the back in the lobby.
Perfect.
Thank you very much.
Awesome. Let's give them a round of applause, you guys. Thank you so much, Michael.